In the Infectious Agents presentation, you will learn about prevention, types of infectious agents, and the District Health Safety and Wellness Program. Infectious agents are bacteria, virus, fungi, or live bugs that can produce disease. In this training module, we will be talking about infectious agents that affect humans. Infection begins with the infectious agent. A useful model for understanding how infections affect the human body is called the chain of infection. The infectious agent travels along the circle in a clockwise direction. The chain shows that with most communicable diseases, there is a way to break the chain and to stop the spread of infection. A reservoir is a place, like a human nose, where a germ gets established and begins to grow and receive nourishment. The portal of exit is where the germ actually leaves a body to infect others. Every time we can stop that exit, the chain of infection is broken. These are examples of stopping the infectious chain. Cough into your elbow instead of your hands when you have a cold. When you encounter blood, make sure there is a barrier between you and the blood. When a lice infestation occurs, don't share your comb or brush with others. The means of transmission is how germs are spread to others. Germs are spread through the air, on our hands by touching the germs, or by coming in contact with blood or body fluid. A person has to have the germ to be able to spread the germ. To stop the chain of infection and prevent an infectious agent from entering your body, you should wash your hands, avoid contact with blood or bodily fluid, or get a vaccine. Hand washing is the most important prevention we can regularly do to stop the spread of disease. The proper way to wash hands is to use warm water if possible. Remember to wet your hands before applying soap and lather well. You should scrub for a minimum of 15 to 20 seconds. Pay special attention to washing between your fingers as well as the back sides of your hands. Move your jewelry around to get underneath. Scrub your fingernails into the palm of the opposite hand. When you dry your hands, remember to dry under your jewelry. Because hand washing is the single most effective way of preventing the spread of disease, wash your hands before and after student care, before and after preparing food, before and after giving medications, after using the restroom, after coughing, sneezing, or blowing your nose, after handling soiled linens or clothing, and as soon as possible after using antiseptic gel. The susceptible host is you and me. Our challenge is to decrease our own susceptibility to infection. We do this by washing our hands, getting vaccines, and taking care of ourselves. Respiratory infections are spread in the air as we exhale and inhale, and sometimes through the things we touch. There is research about how to reduce the impact of the common cold. Current testing includes the use of prescription medications to reduce symptoms. Some research indicates that zinc lozenges may help some people. Streptococcus, commonly referred to as strep throat or strep, is a very dangerous germ. The Streptococcus germ can cause other health problems. A person should never self-diagnose strep throat. A healthcare provider must decide if you have strep throat. It should be treated with antibiotics, and the full prescription should be taken as directed by a doctor. If you are an adult who has not had chickenpox, you are strongly urged to get the vaccine. For adults, it is a 2-time vaccine. Chickenpox is much harder on adults and requires a lengthy recovery period. If a person over 12 years old gets chickenpox, a physician may prescribe antiviral medication. Influenza, commonly referred to as the flu, usually begins suddenly with respiratory symptoms and an overall sick feeling. The flu generally lasts 3 to 5 days. Epidemiologists study the trends of the influenza germs and create vaccines to prevent these illnesses. Each year, they investigate what strain of the flu germ will be present and then produce the appropriate flu vaccine. CMV stands for a common virus called cytomegalovirus. When small children have this virus, they typically have cold symptoms. Most adults developed immunity to this virus as children. CMV can be a problem in pregnancy. If a pregnant woman is infected with CMV, it can affect the fetus. If you are planning a pregnancy and work with small children, talk with your physician about the virus. The doctor may decide to do a blood test to determine if you are immune. If you are not immune, frequent hand washing is your best protection. Fifth's disease is a rash virus that is common in children. In Fifth's disease, children get rosy cheeks and a rash on their arms. The days before the rash appears is when they are the most contagious and feel the worst. The rash will come and go for a couple of weeks. Children who have been diagnosed with Fifth's disease can attend school. Fifth's disease is much less common in adults. Occasionally, adults might experience sore joints as a result of the virus.